Hi, and welcome to the AACP Australia. We're getting ready here for next week's Global Summit on non-CPAP therapies for OSA. And we're really getting excited about bringing this subject to you. We did this presentation earlier this year in Australia, and the content was really well accepted. And we thought we'd like to bring that to a global audience. So that's why we're going to run our Global Summit. I'm here today with Joseph Ryan. Hi, Joseph.
Hi, Charlotte.
Joseph's going to be our fifth speaker for the Global Summit next week. But if you haven't already registered, please do go to our website, www.aacfp.com.au, and make sure that you register, because the event is not being run in our Facebook next week. It's going to be run in a Facebook group. So you do need to register in order to be able to get this amazing content. The event is free. There's no charge for it, and it's going to run over 6 days. It starts next Monday at 7:30 p.m. Australian Eastern Standard Time. It will go for about an hour and a half each evening. We will have one lecture per night, and then we're going to have a final session on Saturday morning, November the 7th. The event will, the lectures will be available until Sunday the 8th. We're not keeping them up beyond that. So if you miss an event, miss one of the lectures, please know that they are still available for the week and you can watch them. Okay, so it's my pleasure to introduce Dr. Joseph Ryan. And Joseph, would you like to tell the listeners, the audience today, where you are in Australia and why it is that you are going to be presenting for us next week?
Sure, Charlotte. I'm in Melbourne currently at the moment, enjoying the little reprieve from lockdown, which has been nice. But I'm in Melbourne just finishing off my doctorate in clinical dentistry in oral medicine. So just finished off my specialty training, which I should finish hopefully by the end of next year. Originally, I'm from Canberra, born and bred from Canberra. I did my dental degree out at Charles. Since graduation, I did a honours in orofacial pain, and then also completed the Sydney Uni Masters in pain management as well. And then that brought me down to oral medicine. And I guess as oral medicine, we do a lot of sleep appliance therapy and sleep medicine, and that link with the orofacial pain, because there's some direct links between sleep medicine and orofacial pain. So it sort of brings it all together for me, really.
Brilliant, and well done on that educational journey. Why do you think this topic, you're going to be talking about MAS appliance design, why do you think this topic is important as part of the Global Summit?
I think it's important because sometimes it's forgotten. Quite often we just look at the dorsal as the only appliance design because it's probably one of the most commonly used appliances, but there are different appliance designs, and it's important to understand why there are different appliance designs, because it's based upon, the correct patient selection as well as the correct treatment to give the patients the best optimal treatment. And so sometimes you often see a patient who has failed CPAP, and then hence they're trying the appliance design and they failed the appliances as well. But perhaps it was the wrong appliance for the patient, and we just need to adjust that for the patient. So I think that's why it's quite an important topic to be covered in any area that talks about sleep and medicine, and in particular it's looking at oral appliances for sleep medicine.
It's wonderful. And yeah, I guess it fits in with the whole paradigm of precision medicine and designing the appliance specifically, or the treatment specifically for the patient.
Yeah, exactly. I think precision medicine is the key word there, and it's obviously brought up a lot in all types of treatment for medicine. And there is no such thing as one size fits all. And I guess that's how we can precisely make the appropriate design for our patients to get the best outcomes.
Fantastic. And I do think that this content next week is really going to help people to learn how to improve and deliver more predictable outcomes for their patients. Tell us, what do the viewers expect to learn from your presentation next week? What can they bring to their practice the following week and start using?
Well, I think you sort of just said it there too, Charlotte, with the predictable outcomes. So with my presentation, we'll be going through the bit of the anatomical differences between the patients that we can see, and also how the appliance designs can be tailored towards those patients to give you that predictable outcome, or also to help you troubleshoot of to why perhaps this particular design isn't quite working, and perhaps how you could change or modify that design, or choose a different design to get the best outcome for that patient. We'll also be talking about the titration of the appliance as well, and what the current research demonstrates is the best titration procedures for the patient to not only give the patient the best optimum for their sleep medicine or their increase in their bettering of their sleep symptoms, but also to make sure that we're not creating any of the side effects that can be related to appliance therapy, such as jaw and facial pain and also occlusal changes. So it's very important to sort of do a risk benefit analysis on how we titrate the patients. There's a little bit more to it than just turning a screw or pushing the jaw forward. So we'll be discussing that as well as it's important with the appliance design. And mainly what I'll be doing is analysing all the current literature, because there is no single standard answer to this question. And as we discuss the literature, I think people will see that the results are mixed, but there are definitely some areas where it's showing a pretty high prediction of what's going to be the best option for their patients.
Fantastic. That's some amazing content, some great tools for people's toolkits. Thank you, Joseph, for the time and the effort that you've spent in putting the presentation together. We're really excited about presenting this information to everybody around the world next week. Joseph will be presenting on Friday evening, 7:30 p.m. Australian Eastern Standard Time, as the 5th presenter in our Global Summit. Thank you for your time today, Joseph. I really appreciate it. And we look forward to seeing you again next week. And to everybody, if you haven't registered, please, as I've said, go on our website, www.aacfp.com.au, and register for the event, because we're holding it inside a Facebook group and you cannot access it on our Facebook site, even if you're watching us here today. Thanks, everybody. We're looking forward to seeing you, and have a great week, and we'll see you Monday. Bye for now.